Hi, everyone. TJ Alt, I-45 now, and welcome to another edition of COVID-19, What You Need to Know with Dr. Philip Keiser. Glad to have everyone joining us this afternoon. I'm coming to you from Friendswood, where we've been with the Friendswood Chamber of Commerce on a special project throughout the morning and into the afternoon. And as we take a look at things, COVID-19, you there on your screen, Dr. Philip Keiser, the local health authority for Galveston County. Dr. Keiser, good afternoon to you. And I know it's been a busy couple of weeks for both of us here lately on stuff. Glad to have you back on with us again. So I got to ask you right off the bat here. We are seeing the numbers go up. About a 11% increase of the number of people vaccinated in Galveston County. 204,000 through UTMB, which is mainly Pfizer, and another 25,000 by the Galveston County Health District. So 229,000 folks have been vaccinated. How's that going along right now, do you think, overall in Galveston County?
Well, overall, it's going very well. So just a little clarification, that's the total numbers of vaccines that we've administered, not citizens of Galveston County. So we're probably a little behind that, somewhere around 200,000 people with shots in arms in the county. But that's really, really good news. And we continue to move forward in vaccinating people. It's getting to the point where we've got this down to its very routine. We had, quote unquote, a slow day at Walter Hall Park on Tuesday. We only vaccinated 2,200 people. So, I can say that we've really got this down, and we're going to keep going as long as there's a demand for it.
And one of the kind of encouraging things that were there is that for those 65 and older who are Galveston County residents, 69% of them have been had at least one of the vaccination shots so far.
Yeah, that's right. And so we're really getting to the point where we're protecting those people that are most vulnerable. And keep in mind that even a first shot offers about 80% protectivity, as opposed to having two shots. So it's not like you get one shot, nothing happens, and then two shots, something magically happens. You start getting protection within 2 weeks of having that first shot, which is really good news.
On that, because Pfizer had come back when we were talking last week that after the first shot that the efficiency rate was pretty high, almost close to 80%. How about Moderna? Are they seeing the same numbers? They're both mRNAs vaccines. I didn't know if we were seeing the same type of results from the Moderna vaccine.
Yeah, and the CDC's actually looked at both of those vaccines together, both Pfizer and Moderna. They had the study that we're referencing is a CDC study where they looked at over 4,000 healthcare workers who had gotten shots with either Pfizer or Moderna. And that's the average rate across both of them. These vaccines have exceeded all of our expectations. We never expected an efficacy of 90, 95% in preventing serious disease. We never expected almost 100% in preventing death. We never expected about an 87% effectiveness in preventing transmission, and that people can, it actually prevents you from transmitting it to other people. So all this is really, really good news. And I think we can see that in our numbers, and that our numbers continue to fall, even though people are out and about more. And I'm pretty happy with the way everything is going so far.
Those of you just joining us, Dr. Philip Keiser, the local health authority for Galveston County, on with us on our weekly program, What You Need to Know, COVID-19. And we're talking about of what we are dealing with now in the current deal. Since the 29th, March 29th was when Texas opened up to all adults. So we had the announcement on the federal level from the White House that somewhere mid-April, the federal vaccine side of things will open up to all adults. How this quicker pace of going along here, how well has that gone, at least what we've seen in Texas or in this area since the March 29th date?
Yeah, well, I think it's gone very well for people who want to get the vaccine. There's still a lot of people that are worried about it. I was talking to a nurse today who just got her first dose 3 weeks ago and is going to get her second dose this week. And I said, well, why'd you wait? And she goes, I wanted to see what would happen. And so we know there are a lot of people out there who are in that group of people who are, trying to wait and see. So we would encourage them to come in and get vaccinated. We have more vaccine than we've ever had. And there are more venues that people can get vaccinated. Obviously, we're doing it with the health district, and we're doing it with UTMB, but there are pharmacies around town, there are doctors' offices around town that are beginning to get vaccine, and we would encourage people to go get vaccinated. I know there are people that are waiting. They're waiting for the J&J vaccine. They're waiting to get, they want Pfizer. They don't want Moderna. They want Moderna. They don't want Pfizer. The best advice is that the best vaccine is the one you can get in your arm. And overall, they look pretty much the same. And so now is the time to do it, because we are reaching a point where if we can continue this pace up, we may be able to get back to business by summer. And that would just be really wonderful. But if we come to a screeching halt because people don't want to get vaccinated, we're going to start seeing cases rise among that group of people, and we may face some further restrictions. So we're asking everybody to get vaccinated.
What would it take percentage-wise, you think, for us to be able to say, yes, we're at a point that's that level where we can return back to normal, as you said?
Yeah, well, there's no hard number because we don't know. And there's some people who, we throw around the number 65%, 75%. One expert recently threw out the number 85%. I can tell you that at UTMB, once we hit about 60 to 65%, we stopped seeing cases among our employees. So that seems to be a pretty good number, somewhere above the 60% range. And I'm guessing somewhere between 65 and 75%. Of course, the real proof of the pudding is the number of cases we get. We can vaccinate as many people as we want, but if it's not effective, we're not going to see our numbers continue to go down. But they've been going down steadily ever since January. And if this trend continues, we're going to be in a pretty good spot. But in order for it to continue, everybody's got to do their part and get their vaccine.
And again, if you have not gotten a chance to do so and you are interested in getting the vaccine, you can go online, utmbhealth.com. /vaccine, or you can call 877-389-2318. That's the Galveston County portal that's set up, and that gets you on the list for either the UTMB administration of the vaccines or those done by the Galveston County Health District.
Right.
That'll give that. We do have a question right off the bat, and it's one of our regular viewers, and Doreen Woofin is asking if someone gets a positive COVID test the day after their first dose, should they still go get their second dose as scheduled, or should they wait longer? This question's come up a lot because we've had these positive tests come up with folks after they've had that first dose. What should they be doing?
They should go ahead and get their second dose. The only reason we would want you to wait is if you're sick. So if you're feeling okay, there's no reason not to get the vaccine, even if you have a positive test. In fact, it's probably better for you if you get the vaccine.
We have a lot of questions, though, too, and you may not be able to answer this directly. It says, does the school district have the authority to make my child return to face-to-face school? I know you're consulting with the school districts here. Clear Creek ISD is offering an option, actually, of keeping its virtual alone if that is what you want your child to do. What are the school districts telling you about what they're going to do, and what are you hearing from the state as far as back to school?
We haven't heard anything specifically regard with back to school. The schools are required to the state to have at least offer 50% capacity for face-to-face. And from what we've been seeing, that's more and more people are migrating back to face-to-face learning, although there are some parents who don't want to send their kids to school at this point. There's more good news on the horizon, is that the Pfizer vaccine has just been shown to be safe in children 12 and above. And so as soon as the FDA gives us the go-ahead, we're going to start vaccinating school kids in that age group. And in fact, it would be a good opportunity that, when you bring your kids in, to also get vaccinated yourself. We don't know exactly how we're going to do it yet. We're going to be having some meetings, and it's not approved yet, so we have some time to work on this. We don't know whether we'll do this through a drive-through or whether we'll actually set it up within schools, maybe within each school district. We'll knock one out each week. And our goal is to get as many eligible kids vaccinated before the start of school in the fall.
And there's also a discussion with of that kind of goes into our next thing of requiring vaccines. In many ways, we haven't heard of what that's going to be for private entities, but we heard Governor Abbott yesterday morning early. This was a key thing for him, announcing that at least if you're a state agency or you receive public funds, you're not going to be able to require people to have had a vaccine. I just wanted to get your reaction to that. There's a lot of folks that don't want to be required to do anything, whether it's face coverings, masks, whatever we want to call it there, or the vaccines. We require other vaccines before students enroll in school. I just wondered, would you recommend that at this point?
Yeah, I think under Texas law, it would be hard to do, because even with schools requiring vaccines, there is sort of the conscience or medical necessity exception. So parents can either say that I can't get my child vaccinated because they'll have a bad reaction to the vaccine, or there's something wrong with them, or they can say it violates my religious belief, or it violates my conscience. And so we have never had 100% of kids getting vaccinated for all illnesses. And so as we move forward, I think it's going to be unlikely, particularly for government in the United States, to require people to get vaccinated. And that's what the governor said. He basically said anything to do with the Texas state government and also with local governments, we can't require people to get vaccinated. That doesn't mean that private entities can't. That has yet to be decided or looked into. But where I really suspect we're going to see it a lot is in travel, and particularly people traveling internationally. There are countries that are going to be requiring people to demonstrate they have the vaccine. Great Britain in the near future will do that. Cruise lines are going to want everybody to be vaccinated. Interestingly, the airlines are doing just the opposite. They'd rather have a testing strategy because it opens up a whole can of worms that people don't want to get into. So I don't know. We're going to have to wait and see how it all pans out.
Yeah, and I find it interesting when we talked about the difference between airline travel and cruise travel. But I think too that there's a difference here. You're stuck on a boat for 6 days,
right?
With a lot of folks versus being on a plane maybe a few hours. Right. With folks, it can be transmitted in 1 minute, obviously, or 1 second, actually, if you're concerned about that. But the situations are a little bit different of the I guess the risk of infection, but it is different in the travel industry. And it was one of those is that Norwegian had come in and said that they've asked the CDC to change its recommendation, not requirement, I should say, not recommendation, of November 1st when cruises can resume, of saying, listen, if we make a requirement that everyone who comes on board, everyone who works on the ship has to be vaccinated, will you at least back that up some? What do you think of that argument from at least in the cruise ship terminal, Eric? Because that affects, that's in the long run, if they all do that, that's going to affect Galveston by a significant amount.
Sure. I'd get on that shit. I mean, I really would. That's how much confidence I have in these vaccines. And I think particularly for cruise lines, that's probably what they're going to have to do. Remember, what we've seen is that when you get on a ship that's infected with COVID, and if you're on there, it runs rampant. And that was actually a source of of COVID in the United States. Not the only one, obviously. But when people were on the cruise ship in Japan and brought back to San Antonio, and then it started spreading not only among them, but also people in the area. So the cruise ship, one of the hard lessons we've learned is that once you get COVID on a cruise ship, you got to shut down the ship. You got to get everybody off. That's just what you got to do. So vaccinating the entire crew, great. And asking people to be vaccinated as a requirement, I think that's something that they have to do. But remember, they're private entities, and also remember that they are not entities that are actually even registered in the United States. Norwegian is from Norway. Many of these ships are in the Bahamas. They're registered in the Bahamas, and so they're not under the same sort of constraints that we are, and they will have the ability to say, if you want to get on the ship, you've got to get this done. So I think we just roll with it. And if you want to go on a cruise, be prepared to show somebody your vaccine card.
Yeah, in fact, one of the things we're seeing over in Europe, some cruises already resume in some areas. I think that a lot of folks are watching those closely to see what happens there. But it is an important an area for us in Galveston, particularly. Is that as you see that, and I'm sure we'll hear the other cruise lines come up. Another question came up. This was something we talked about last week, but a good one here from Steve Van Horn Jr. It says, have we started any plan for early COVID vaccines? Read today, Moderna good for 6 months, which means my 6 months is up in July. And that was it because Pfizer was the first to come out with that, and we just talked about Moderna here just a few minutes ago between us. At this point, are we going to be talking about, all right, now we got to talk about a second dose, I guess would be a way of doing it, or a booster dose of that. Right now, we only have 6 months of data to go on. Is that that's more to do with what we're looking at, or does we think that may be longer period of time before needing to get another dose?
Well, I hope we don't need to get a second dose. I mean, my 6 months is up in June, and I think we're all in that same boat. But keep in mind, when they say it's good for 6 months, that doesn't mean it's not good for after 6 months. All that means is that we tested it at 6 months and the immunity is still there. And, so we see this with things like, food expiration dates and drug expiration dates. The food is probably good after that date. It's probably the drugs are good after that date. We know that from studies we've done. And so we expect that this immunity is going to be much longer lasting. But there is a chance that we may need to get a booster. If that happens, I'm guessing, and it's just a guess on my part, that it would probably be sometime in the fall, not at that hard 6 month time.
And so will it, you and I have asked about this, but I've asked you about this before, is that we expect this to be kind of like the flu, and flu vaccines is like every year you got to go in and get it?
Yeah, maybe. It may turn out that way. Or it may turn out that we just have what we call an endemic infection, where we get enough people vaccinated, but we have these smoldering cases that are just around all the time. And that we may have COVID with us for a long period of time. But I would not be surprised if we end up having to get a COVID vaccine every year or every other year.
Mike Linton has a question here. It says, can you give me an explanation as to why Texas is improving on its cases and hospitalization rates, whereas states like Michigan and Vermont are increasing? Because that is kind of baffling, because, you would think that we would see the similar progress elsewhere, but we're not seeing that in many states.
Yeah, can I give you a good? No, I can't. In all honesty, I can't. Other than I think a lot of this is driven by two things. One, vaccinations and human behavior. And it's really struck me that, when the governor announced that he was opening things up, a lot of us would be concerned that people are just going to throw the mask away and people would stop being careful. But it's very interesting. People are being very careful. You come down to Galveston, you'll see a lot of people with masks on as they're walking around and going into businesses. You see people on the beach, and they're all in their little clusters and keeping to themselves. And it's really good to see people taking a sense of personal responsibility for it. I have a friend of mine out in California where they're very much in lockdown, and they've had a worse time than we have. And so a lot of it, I think, comes down to that in terms of what are people actually doing. And I'm also very pleased that people are not saying, I've been vaccinated, so I'm going to take my mask off. Most people that have been vaccinating are still being careful and still wearing their masks. And so I think it's a combination of the vaccinations and people observing personal space that's making the difference.
And it goes into, that gives me to the next question about the variants that are out there. Yeah. Because some of the studies that I've been looking at the last couple of days have talked about that what's driving much of the increases have been the variants. And the CDC had come out with a report that the UK variant is now the most dominant strain in the United States. How concerned should we be? Because in California, there's actually two separate variants happening in California too. One is a little more resistant to vaccines, and the other is just easier to spread. How concerned should we be about these variants we're seeing right now?
Well, I think we should be concerned, but I don't think we should be terrified of them. Does that make sense?
Right.
In that, we know they're out there. We're actually, we did a sample. I haven't seen the latest this week's data, but data from last week. We had samples done in the week of the 14th of March. Almost 60% of them were the UK variant here in Galveston County. And yet, despite that, even though the majority of the samples that were tested, despite that, we're still seeing a decrease in the numbers of infection. Now, there could be a lot of explanations for that. Even though that's the one that's spreading and people are concerned that it can spread more rapidly, people are still socially distancing and people are getting vaccinated. And the vaccines that we're primarily using, both Moderna and Pfizer, are still active against that UK variant. So, it's hard to understand it all. We're really good at trying to explain things once it's happened. But I think there are a lot of factors in the transmission we still don't completely understand.
We talked about travel earlier. I wanted to get back to, there's one question I forgot to ask you about, is that the CDC is actually recommended if you are vaccinated, it's safe to travel again. And I just wondered what precautions should folks still be taking, though, even if they are vaccinated and they're heading out to travel, because you're not sure if the person next to you is.
Right. So again, what you have to do is, first of all, that recommendation is for travel within the country. Okay?
Right. Domestic. And right. I should point out domestic travel.
Because coming back into the country, they're still making you get a test. Now you can argue that that's a little inconsistent. So for people who go down to some places in Mexico that have lower rates of COVID than we currently have, they have to get a test. Yet if they were to go to Detroit, they wouldn't have to get a test. So the CDC is still working on trying to get good information and get all of those recommendations together. But that being said, what you can expect is the airlines are going to make you wear a mask. And I think that's a good thing. And so you continue to follow all the social distancing requirements, but don't worry as much. And I think that's the real key. Remember, you're vaccinated and your chance of getting COVID has been reduced by about 90%, which is really very strong. And then with everybody masked, that reduces the risk even that much more. So I think it's okay. And I think the changes that we see in policies and procedures and the way we have to conduct ourselves, it's not going to happen all at once. There's not going to be an announcement that the war on COVID is won, and people are dancing in the streets in Times Square and kissing each other. I don't think that's going to happen. What I think is going to happen, I think it's going to slowly fade away. And then as it fades, we will keep walking back a little bit, walking back a little bit, walking back a little bit, until we get to the point where whatever the real new normal is where we are.
We talked about the variants. We've talked about what we're dealing before. The one thing is we talk about vaccines a lot now. How about treatment of those who get COVID and have some type of symptoms? Is there something out there? I know there's been some, we have the therapeutics and we have the treatments in the hospital, but something that can, how much research is being done on some type of medication to take once you have it, but maybe you're just showing symptoms like you would a flu, where you get like the Theraflu. Right. Not Theraflu, but Theraflu, or something like that. Some over-the-counter versus prescription. I mean, I know I have prescription first, but where are we on that at this point?
Well,
Tamiflu was the term I was trying to say, not Tamiflu.
Right. Yeah. So we're getting there. That's the quick answer. But remember that it's not developing oral forms of drugs takes a little bit longer, and that the FDA is not going to be as quick to approve some of these drugs when they first come out, because we already have things. So, we have remdesivir, which we know works if you give it early. We know that we give people steroids, that helps prevent having progression of disease. We have monoclonal antibodies that we can give people that actually prevent disease. None of these by themselves are really great. So we saw the same thing with HIV drugs. The first set out were not very good, were approved very quickly. But then you start seeing slowly refinements of those drugs. And as they come out, this one's a little bit better, this one's a little bit better. So I wouldn't be surprised if within the next year or so, we do see an oral drug to treat COVID, and something that we can give people early and help prevent them from getting into the hospital.
I wonder, though, in the process, though, we've had emergency authorization for the vaccines. Given that it's one thing to get an emergency authorization for a vaccine, but for treatment, like you said, is that why you think it'll take longer to do that? They're going to go through the more deliberate process that, although it hasn't been, I should not word it that way, because it's been deliberate. It's just been more fast forwarded in many ways. But do we think the process will just take longer so it goes into the more routine?
They're going to be more careful about it because there are already therapies out there, and you can expect that to happen. We're seeing this already even with vaccines. So, Pfizer came out, we had it in our hands in about 2.5 weeks. Moderna, about 3.5 weeks. That's extraordinarily fast. J&J, same story, about 3.5 weeks. The AstraZeneca vaccine, there's been controversy about it. There have been some side effects that were unexpected. That went to the FDA over 3 weeks ago. You haven't heard a word. And the reason why is because there are effective vaccines that are available that are already being out there and being used. And so the FDA is going to slow it down a little bit to make sure that they're not doing it too quickly and that they address all those issues that have come up. And I think you can be assured is that if and when AstraZeneca gets authorized in the United States, it will have been gone over with a fine-tooth comb because of the fact that they have time to look at it. And we're going to see the same thing with drugs as they come out. Initially remdesivir was an emergency use authorization, but then that actually got approved. And again, in record time, but it took them probably 5 months, 4 months to actually approve it. And so we're going to have to expect that we're going to see the same sorts of things as new agents come out. They're not going to be too quick to approve them because we have other things, and there is always a risk of some side effect that someone hadn't anticipated. So they're going to look at it carefully.
Well, while it's not going to be looking at it too quick, I wonder though, and this is a question I've been asking since we started seeing the quick development of the mRNA, and particularly the RNA vaccines, anything using the mRNA kind of technology has shown to be able to be done quicker in many ways once you have certain things figured out. Yeah. Is there going to be an expectation now, since we saw a vaccine or 2 vaccines, technically 3, done in just about a year, that the expectation may be that, hey, we don't need to be so slow before getting the approval process in, that maybe now we need to catch up?
Yeah, no, I think you can expect that. So I think once we get through the COVID, what I expect is that the FDA will look at its processes. And so typically, traditionally, the way a drug is approved is that, they study it in the test tube. And then they say to the FDA, well, we'd like to develop this. And the FDA looks at it and says, okay, you can go to step 2. And what happened with the vaccines was they did step 1, step 2, step 3 all at the same time. And so I think you're going to see more of that, where it's going to be allowed to develop things in parallel instead of having to do everything in a sequential fashion. They're still going to add the same burden of proof to make sure that things are safe, but I don't think you're going to see things taking as long. The second thing I think we're going to see is I think we've just seen the beginning of RNA vaccines. Like I said, these, not only is it easier to produce, and if we do need a vaccine which covers some of these variants, which we don't have yet, it will be very easy to make the changes the way this technology works so that it can get out very, very quickly. So they're easy to produce, and the ways that they can be used is just innumerable. I wouldn't be surprised if we start seeing vaccines for cancer. I wouldn't be surprised if we see vaccines for HIV. I wouldn't be surprised, just any type of thing you can imagine with this type of technology, because people are going to be putting a lot of money into it and a lot of effort, because this has been a home run. No one expected it to be this good.
I mean, and RNA vaccines have been looked at for a good while, and that's why I find it fascinating as we talk about this now. And I think this gets into the kind of, I call it the geekdom, the nerd side of me on this. And that's why it's fascinating to talk about, is that the development of RNA vaccines and what it could open the door to. You just needed that one thing to kind of push it through. And this seems, if anything, COVID-19 means the one thing that proves, hey, look, not only can we do this quickly, we can do it safely and move on from there. But
that I think is the real key, TJ, is the safety issue. Some of the things that held back the RNA vaccines over the years was that they were all done in small trials, and well, will this work? Well, maybe it does. Is it safe? Well, we don't know. But now we have literally put these vaccines in the arms of millions of people, and we know the technology is not harmful. So that's really what's going to open the door.
Yeah, and it's an amazing technology to watch as it comes to bear for folks. If you're joining us late, Dr. Philip Keiser, the local health authority for Galveston County, is on with us now, and we were talking about COVID-19, and one of the things is and obviously we have a question. She actually asked this, I think, after we'd finished the show last week. And I just wonder if there's certain folks that, they worry about they'll have a neurological disorder or something like that where they shouldn't be taking a vaccine if it had been a normal route. How about that? How safe are these for folks with Guillain-Barré? Those type of ailments that should they be worried?
Yeah, well, it's a very good question. We had that question a lot when it was coming out. And we had a lot of, I don't want to say a lot, but we had some people come to us and say, I've had Guillain-Barré and I don't know if I should take the vaccine. And initially we said, we don't know either. But we actually have had several people who have taken it and have done well. And currently there's no warning or concern about the Guillain-Barré for the vaccine. There was in the news this week that there was a case of Guillain-Barré in a young man who had gotten the vaccine up in the Houston area. So remember, this is a very rare disease, and it's basically where the sheath around the nerves gets dissolved, and so the nerves stop working for a period of time, and sometimes people end up on a ventilator, and sometimes people die from it. It can be very, very serious, but it's very, very rare. So anytime you do something, hundreds of thousands of times, it's just the law of averages that you're going to accidentally have somebody who will get a reaction, or not the reaction, who will get this disease afterwards. And then we have to ask the question, is it due to the vaccine? But so far, except for very isolated cases, we don't have any evidence that it is related to the vaccine. And we have given it to people who've had it in the past and they haven't had any problems. That's about the best we can do. Can I promise you nothing bad will happen? Of course not. It's just not the way life and medicine is. But so far, I think it's okay.
Yeah, I'm glad. Thanks for saving me on that on GBS. I never pronounce it right, no matter how many times I have practiced it over the year. I should have just gone and just tried to have said it in the GBS as I normally have in the back. Someone back with a question on travels is, can we fly if we don't get vaccine? Right now, you can, Janie, but we should ask. Someone had asked a similar question earlier. Yes, you can fly if you've not been vaccinated. And in fact, the airlines are saying, we don't want to require folks to be vaccinated. We want to do more of a testing protocol along the way, and not a requirement protocol for vaccine. And I wondered, what do you think is more effective for the airlines to do there? A testing protocol versus, hey, here's your vaccine proof?
No, that's a tough one. Here's the problem with doing testing protocols. They all work well until they don't. So, we saw what happened in the White House. They tried to build a bubble around the White House and through testing everybody every day. But some people accidentally got through, and then they had a big episode of it. So testing in and of itself, you're going to have things where things break through. Testing plus having social distancing and masking protocols is pretty effective. But personally, I think vaccines really are what's going to make the big difference with all of this. So, if I had to pick one strategy, and fortunately we don't have to pick one strategy, I would say, let's get everybody vaccinated.
Yeah. And for airline travelers, I should point out, I think I brought this up last week. I have Clear for travel purposes. And it's already being offered that once the verification's been given to them, they put it in your system and it shows, yes, we verified this person's been vaccinated. So it's an easier system there to have. It's kind of one of those front of the line things. Does it become, well, we're not going to require it, but if you want to check in faster, something that may be an incentive. Either one, right now, the airlines don't want to go with that, but they're also have not been told you can't fly. And that's why I think we're seeing a different strategy from the cruise ships companies now. Well, only one so far, but I think the others will follow, from what I've been told, that they're saying, well, we're still allowed to do business right now. So we got to find something to
Right.
say, let us do this at least to go anyway.
Well, I think the cruise ships will, of their own volition, say you need to have a vaccine. You know, out in, was it in the Caribbean or was it in the Mediterranean? There was a small cruise ship where they tried to do the testing strategy and then they had an outbreak. So again,
Right.
testing works until something slips through. And then if you put people in a high risk situation, like in a cruise ship, that's when you can have real problems.
I was talking to a cruise ship expert the other day, and he was explaining to me that who he's talked to several of the cruise lines, and one in particular did a survey of its VIPs, you know, the regular cruisers, which makes up the bulk of its business, and they said we would prefer to have a vaccination requirement versus the other, And I don't want to get too stereotypical, but you got to understand too that the population of regular cruisers are older population.
Right.
Again, I don't want to come across as every person who gets on a cruise ship is old, but it was an interesting thing when because it was a high percentage of what he had shared with me, and that they're gathering this information. That's why I think we'll expect other cruise companies to come to the CDC and say, hey, let's loosen this up a little bit if we require this, because they're gathering that info, because it's going more than a year now, and November 1st right now is the dateline for the U.S. sailings that the CDC has put in requirements, which goes to the other thing of vaccine passports. We talked about it early on. From a public health perspective, the concerns comes in. Governor Abbott brought this up yesterday, was about the privacy issues. I just wonder how concerned are you of this type of thing, because you've been careful with this just in talking about folks being diagnosed. How cautious are you about just somehow, because there is a push to publicize who has or hasn't had disease, like how concerned are you about having this kind of divides into classes of who's been vaccinated, who's not, who's had COVID, and who's not?
Yeah, well. So first of all, we're not going to publish anything with what that would.
Right. I'm not saying you. I'm just
right. I know. I just want to make sure we clarify that, because otherwise we'll be waiting in line on the ferry again. But we're not going to do anything like that. Now, there is technology out there, and it's not hard technology, where you can verify people's status with anything by using cell phone technology. So the way that would work is that you would have an app. That app would be connected to some trusted source, whether it be a hospital or a local health department or state health department. And then the people that they say, okay, show me your vaccination record. Well, what that person would do is they would simply take a picture of a QR code, and then you'd get a check mark, and it would say that it's done. So you don't have to reveal any information that you don't want to. But there's a lot of concern, and it's interesting. It's not from the right. It's not just from the right, it's from the right and the left, in terms of what does that mean for civil liberties, of asking people to document that they are vaccinated. And for government in particular, people may not be vaccinated because they don't want to. People may not be vaccinated because they haven't had the opportunity to. And so to say then, well, you can't come into a government building if you have business with the government, that would be a pretty harsh thing. And I think most people want to avoid that particular situation. But as we've talked about with cruise lines, obviously there's some situations where I think everybody would feel very comfortable verifying that everyone has a vaccine. And where you draw the line, I think that's something that is well above my pay grade. We know we're not going to do it in government buildings. We know it's probably going to happen on cruise ships. Does that mean for a big sporting event? I don't know. Does that mean, if you want to walk into a little store and buy a candy bar? Probably not. But so it's going to take some time for, lawyers and ethicists and politicians, as well as public health people, to come up with an answer for this. From our point of view, one of the things that we want to make sure, and we're not there yet. I mean, I would be very happy to provide people with digital documentation of their vaccine status. And if we did that, that's just, we don't have plans to do that at this point. We don't have the technology to do that. But I could foresee that happening. And if we were to do that as a health department, it would simply be, yes, you want some digital documentation of your vaccine status. Here it is, just like with my car insurance, and that's all it would be.
Yeah. And in fact, I'll share mine because it's not giving up too much here. But if this is actually my chart from UTMB,
right,
and you can go to a section here on this. It says COVID-19 vaccination complete. Right there in fact, if you have not checked it out lately, folks, the My Chart had a revamp, in fact, and it looks really cool actually from UTMB. My Chart is not just UTMB, but it's a nice revamp they did, but it's right there on the phone, and I can pull up any record there, and it's straight from the UTMB Health itself. Before we get wrap up, as always, I wanted to bring this because we always have those that come in and says, Harley Blunk says, I'm not sure this is the real name or not, but will not follow the herd. I will not be a sheep, will not get vaccine. We have a considerable amount of folks that are there. No one's requiring this of you. We're encouraging it, obviously.
Right.
No one's requiring it.
Right.
But there are concerns. I've just talked to someone earlier today who said, I don't want to be told I have to do anything. I said, well, you're not being told. Yeah, but everybody's saying I have to do that. And that's not everybody, but I understand what she was saying is that, yes, you're being encouraged to do that. You're not being told, but there are still some folks. And I don't want to say, I guess it was said people just are concerned. A lot of times, even medical professionals are concerned how quickly everything was developed. Do you fault them for having that thought, no matter how much information is out there as it is right now with the vaccines?
No, I actually fault ourselves. I mean, I fault the public health establishment, and very early on, it's very easy to get sanctimonious about this, right? And people don't like that when they're talked to that way. And then there was confusion early on where we said you don't need to wear a mask. Oh yes, you do need to wear a mask. And we went into lockdown and we told everybody once we go through this, everything will be fine. So there's a lot of distrust out there, and I get that. And there's a lot of, well, you said this, you said that. Why should I listen to you now? And all I can do in that, and said, at the time we were trying to do the best we could with the information we had, but from what we've seen so far, I would really encourage people to get a vaccine. I've had mine. It's fine. I had a sore arm. And after the second one, I felt a little sick, but I've certainly felt sicker from eating too much. We would encourage everybody to do it. We think it's going to be good for you. It's not harmful. I'm almost 6 months into it. My arm hasn't fallen off. I haven't died. My cell phone coverage has not improved. That was a disappointment because I thought it'd be a 5G transmitter.
the whole 5G network thing again, right?
I was kind of hoping that rumor was right. But
for those let me explain. For those who don't know about this, we've actually talked about this before. There was a rumor, and particularly a very heavy social media thing that said that really what they were injecting us with was something so our 5G cell phone network would work better. So you'd have like a 5G transmitter or something. I don't know what it was, but it was pretty hot. We had legitimate people were not joking. They were asking us in the show, is this true?
Yeah.
And we had to debunk it.
Yeah. We had a little old lady come in, and she was right before she got her vaccine. She looks up at the nurse, very scared. And she goes, "This isn't the one with the chip, is it?" And I was like, no, it's not the one. We're not giving you chips. And so people hear this stuff, and it scares them. And it's not one thing. It's just a whole milieu of distrust. And so what we want to try and do is win people's trust and get people in and let them see that it's okay. And if you're feeling pressured by somebody, talk to somebody who you trust, who's gotten it, and see what they say about it. And I think people will come around. The other thing is we don't need 100% of the people to get the vaccine. We need we think about 75%. So if we can get those people that are locked in, then we should be okay.
All right. And reminder is that folks said, according to HIPAA, no need to disclose your health info. That's right. And I think there's been some concerns that it could go to the extremes. And again, like you said, maybe a fault of the medical professional not being more of a as you said, maybe sanctimonious, maybe too harsh of a word, but maybe it did come across that way. I will credit, at least with our weekly visits, what we've done is just stick with the information we know, encourage folks where we need to, but really not, and not say you have to do this. I agree with the premise. As I said, the lady told me earlier today, who I spoke with, said, I just don't like being told I have to do something. Right. And I get that. I do get that, and everything else. And we'll close it out with this. Sean McMahon, he got a second dose, and he feels like crap today. And that has happened. I mean, there's no doubt about it. I was just fine. I didn't even have the sore arm after the second dose.
You're like my wife. She had nothing, and she's like, "What are you complaining about?"
Yeah.
So my advice is take some Tylenol, get some rest, drink lots of fluids, take a nap, sit and watch Netflix, and take the day off. You earned it. And tomorrow you should be feeling better. Even if you're not feeling bad, just go ahead and do it anyway, right? See if you can at least get away with it for a while. Not encouraging that, just we'll point it out. It's something you could do. Dr. Philip Keiser, local health authority for Galveston County, has been on with us. I appreciate you as always, Dr. Keiser, for coming on with us. We'll try again, get back on a schedule. This week it was me who had to move it off our Monday night schedule because we had a big forum that night we had to get ready for, and I was running behind. But I appreciate you adjusting your schedule this week. And again, as always, folks, if you have questions when we're on, you can send them over to us, and we'll be more glad to air those as I have said. And again, by the way, and I said we're going to see the dose numbers go up. A lot of second doses of Moderna being taken care of by the Galveston County Health District today over at Walter Hall and at their clinic. So that's going to be on next week. We'll take a look at just kind of how the progress is going overall. You said y'all are trying to match up state numbers with the local numbers to see how accurate percentage-wise everything is. Yeah, and we're also working on a zip code analysis to see where the places that are not getting the vaccines, and we're going to try and concentrate on some of those areas. We found that as we go out into communities, even though the events are smaller, we get people that would never drive to a clinic or drive to a mass testing site. Yeah, and that's why I was asking about that. Is so as we see that transition to the community sites and going to the clinical sites along the way, now you've gotten the numbers kind of getting more of a manageable deal, make it part of a regular routine along the way. So we appreciate it. Dr. Philip Keiser, local health authority, Galveston County. Thanks for coming on. Again, if you are interested in getting the vaccine, you can go on to the Galveston County portal, utmbhealth.com/vaccine. or call 877-389-2318. Until next time, I'm TJ Alt, I-45 Now.